Hi everybody, today I'm going to be speaking with Dr. Haider Najjar, who, if you've seen the interview I did previously, Dr. Najjar is a specialist gynaecologist, he's an obstetrician, he's a fertility specialist with Melbourne IVF, he's an advanced laparoscopic surgeon and a robotic surgeon. Is that about it, or is there a bit more?
That's about it. Thanks, Kathy.
So today we're going to be talking about PCOS. So firstly, before we get into it, is there anything you'd like to tell us a bit of anything else about what you do?
No, this is our second encounter now, Kathy. I've been privileged to have participated in your first, or that's what you told me anyway. That's, I think we covered that last time. We do
Cool.
general obstetrics, gynecology, fertility, and endoscopic surgery.
Excellent. Okay, so, all right, so what is PCOS?
Well, PCOS simply is an acronym for polycystic ovarian syndrome. Okay, and it's very important to remember from the name, it's a syndrome. It's not a disease. And a syndrome, by definition, is a combination of a few symptoms and signs. We put them together and we call them a syndrome. It's very, very important for patients to understand that it is not a disease as such.
Okay. So, sorry, you got something more to say?
Oh, no, absolutely. I can elaborate more, on that. It's if you wish. It's I said it's a combination of multiple signs and symptoms, and it occurs when basically in around 2 to 3 at least women out of 10 would have polycystic ovaries. By the way, we changed the way we call it. We don't actually say polycystic ovaries, we say multifollicular ovaries, to make a distinction between someone who has the full syndrome or the condition and someone who just have ovaries that are multifollicular or previously we call them polycystic, because a lot of women who have multifollicular or polycystic ovaries and they don't have symptoms, then there's nothing wrong. They don't have the syndrome. Okay, so to make the distinction clearly between the syndrome and the fact that some women can have ovaries that are multifollicular, it's important to understand that.
Yeah, cool. Yeah, I've got that. So what causes PCOS?
Well, some women are born with the ovaries being like that. A lot of it is it's familial. So it runs in families, and often the mother has it, and the other sisters has it, and the cousins. So it's there is a tendency for it, or more, the incidence is higher in women with Mediterranean backgrounds, so the Italian, the Greeks, the Lebanese, the Egyptians, anyone that originally descends from that part of the world has a higher chance of having it. And I don't want to bore you with the background for that. It's too technical. We can sit and talk about this for another hour, but I'm mindful of your time. But that's really, so there's no, it's not a disease. It's a variation, if you wish, of normal. And a lot of women, it doesn't exhibit any particular symptoms or problems. So it's not caused by anything. It's just the way that the ovaries are. Okay. It's what happens later on in the body and the lifestyle and the weight and fertility that can then determine if this is going to be a condition that the woman can suffer, or the ovary is going to be just multifollicular with no implication or negative impact on the patient's health or fertility.
Okay. So for somebody that does have PCOS, what sort of symptoms are they likely to exhibit?
So the symptoms can vary, but remember that the most common is no symptoms or asymptomatic. So a lot of women have multifollicular ovaries, or previously called polycystic. And I'm repeating myself, but I really want to repeat this message because it's very, very important. And on that, I see a lot of my patients come in and say, I have cysts in my ovaries. Okay, and this is also an opportunity to clarify this. They're not cysts, they're follicles, and the follicles have eggs in them. So for anything to qualify to be a cyst, it has to be bigger than at least 3-4 centimeters in diameter. And these follicles, by definition, for us to call them multifollicular or polycystic ovaries, they have to be less than a centimeter. So they are not cysts. They are multiple follicles in the ovaries. Okay, and I'm sorry to go back to that, but it's important to understand, to get our head around the difference between multifollicular ovaries, polycystic ovarian syndrome, and women who have cysts in their ovaries. They're three very different things. Back to your questions. I've forgotten about it. So the signs and symptoms. So they basically three main things. The first one is the impact of polycystic ovarian syndrome on the menstrual cycles. Okay, so abnormal bleeding, irregular, infrequent menstrual cycles. Okay, and so that's one of the first and the main issues. The other issue would be to do with the hormonal imbalance and the high level of androgens, and so there will be skin issues, for example, excessive acne or abnormal hair distribution. And the third one would be that of fertility. And because women who are affected by polycystic ovarian syndrome, they won't be ovulating regularly. They won't be releasing eggs every month regularly. As a result, their periods would be irregular. Some of them can go a whole year or longer without a period in severe conditions. And as a result of that, they will have difficulty, or they can have difficulty in conceiving as well. So periods is the first one. Skin issues, acne and hair distribution, and fertility are the three main things. There are other health issues that may be related to polycystic ovaries, and it's all to do with the sugar metabolism. Yes. Okay, and so women who have polycystic ovaries, especially those who are overweight, they are predisposed to diabetes, and they predisposed to gestational diabetes once they're pregnant as well, and have a higher risk of high blood pressure, heart disease, if not well controlled. Okay, and there's also some link with cancer because of the high level of estrogen and abnormal lining in the endometrium. But these are more medium to long-term effects on general health. But the three main acute issues that women encounter are bleeding, skin issues, and fertility.
Can I just ask you a question regarding the periods? Is pain something that's associated, like painful periods, with PCOS, or is that not connected?
No, it's not connected, not to our knowledge, and I'm only a man. What would I know, Kathy? But it's in reality, and according to the knowledge we have on this condition, there is no link between polycystic ovaries or polycystic ovarian syndrome and pain. Pain is likely to be associated with other conditions like endometriosis and a few other things. Having said that, when women have irregular, infrequent menstrual cycles, or what we technically call them anovulatory cycles, that means they are periods that are not regular and they're not a result of ovulation, these cycles tend to be long and heavy. And as a result, I would imagine they would be also painful because of the length and the heaviness of the periods. But apart from that, there is no direct link between pelvic pain and multifollicular or polycystic ovaries.
Okay, thank you for that. And how is it normally diagnosed?
The best way to diagnose polycystic ovaries would be a pelvic ultrasound. So diagnosis medically, we make diagnosis clinically by history and examination. And as I said, when women come in and have these clinical issues that I listed, periods, skin issues, fertility issues, and on examination, if their BMI is high, if they have these issues obvious on the skin, then we have a high suspicion index of the condition. And a pelvic ultrasound usually tells us very easily the number of follicles in the small follicles, not cysts, in the ovaries, and also the blood test that we can do that check the hormonal profile. That will give us another indication. So symptoms, ultrasound, blood test. There's 3 different lines that we look at.
Okay, cool. And what's the general treatment for PCOS if somebody, I suppose, is symptomatic or asymptomatic?
Okay, so if somebody is asymptomatic, then they don't need anything. Okay, if someone is happy and is not suffering irregular periods, is not suffering skin conditions, then the only way we would know that they have polycystic ovaries, or now called multifollicular ovaries, is by them having an ultrasound or a blood test accidentally, and then we will find that they have that, and we just tell them that you have multifollicular ovaries, but no problems, and they don't need to do anything. Okay, in this syndrome or condition, remember, it's not a disease. Okay, and because it's not a disease, we only treat the problem. Okay, so if patients come to us, a lot of young women, young ladies in their late teens, and they not yet, fertility is not an issue for them, but we see them with heavy irregular periods, then we treat that. Okay, we don't worry about fertility. If they have skin problems, then we treat the skin issues. Okay, and again, I don't want to bore you with the options of treatment, because that alone would require, but something as simple as the contraceptive pill in terms of medications. But before we get into any medications, the biggest issue here is lifestyle. Okay, before we start giving patients medications, all medications carry side effects and can cause problems. Okay, so before we actually start administering medication, we need to address the issues that can be addressed naturally without needing medications. And I call this the low-hanging fruit. You know, it's easy. It's easier to do that. And you know, by adopting a healthy lifestyle, and watching weight, being fit, these conditions express themselves much worse when the patient is overweight. Yes. Okay, so a lot of these problems will be resolved by just losing weight. So for those women who are overweight with polycystic ovarian syndrome, so a lot of my fertility patients, you know, I tell them even losing a small amount of weight can actually convert them from having anovulatory cycles, these long and infrequent periods, into having regular periods, and they ovulate. And that's all they need. They don't need to have medications or injections or operations. There are all sorts of things that we can do, but we always start with the lifestyle. Okay. And treating those conditions is treating the symptoms. So women with periods problems, you know, failing the lifestyle, you know, management, then we can use medications. They're usually hormones like the pill. If there's issues with hair, also the pill actually can help. But there are other treatment options just to help with the skin and hair. Women with fertility, we help them with ovulation induction medication, like the good old famous Clomid tablets. That would be one of the easiest and least invasive and straightforward and not expensive. There are operations we can do, minimally invasive procedures where we do drilling of the ovaries, and that can naturally help the ovaries to release eggs. And if none of these things work, our last resort will be assisted reproductive technologies, which will be intrauterine insemination or IVF.
Okay. So PCOS affecting the fertility, is that's around the fact that the periods are irregular and the eggs aren't being released regularly?
Exactly. Okay. Exactly. So when the ovaries are multifollicular, or have multiple little follicles around in the periphery of the ovaries, then the ovaries, due to biochemical and metabolic complex process, they don't release the eggs once a month as usual. Mm-hmm. And if women don't release eggs once a month and they don't know when the egg is released, it's hard for them to know when they're ovulating, so they don't know when to try. And they will be sometimes ovulating once every 3 or 4 months, but they don't know when this happens. Some of them conceive by pure luck, which is great, but it's, the ability to fall pregnant when couples try naturally, it all depends on knowing when you're ovulating. Mm-hmm. And if you don't ovulate regularly, it's going to be very difficult to know when to try.
Yep, that makes sense. Okay. So what should people do if they suspect they've got PCOS, that they've got symptoms that they think may be related? What should they do? Is there a time factor that affects them at all?
The first thing is to address the lifestyle issue. And I can't overemphasize the importance of lifestyle here. By adopting a healthy lifestyle, by losing a few kilos, you can readjust the whole biochemical system, where the sugar metabolism will change, the estrogen metabolism and the amount of estrogen in the body, and women can start ovulating and having natural fertility without the need for any treatment. So this is the first and the most important step. And on that, and before we elaborate on more, it's not just about falling pregnant. A healthy lifestyle, healthy weight, being fit is very important for after conceiving. Mm. So women who have a high BMI have firstly difficulty falling pregnant, but afterwards at higher risk of miscarriage and higher risk of abnormalities in the pregnancy. And as the pregnancy progresses, will be higher risk of gestational diabetes, as I mentioned previously, preeclampsia, and growth abnormalities in the fetus, which can lead to either really big baby or very small baby. And they all have difficulties then in giving birth as well. Mm-hmm. They need more help, higher chance of cesarean section. So a lot of these things can be avoided right from the start by improving the lifestyle and adopting a healthy one. And when you add this issue to a big issue that we deal with fertility, is the age. Okay, a lot of patients that I see in my practice, they come to seek help when they're in their mid-late 30s, when the quality of the eggs deteriorate, the number of eggs goes down. So it's really important before you start seeking any medical help, and is to try to address the issue of the weight and the BMI and the lifestyle.
Okay, that's really important, isn't it? Not just waiting until you want to get pregnant to address it.
No, absolutely. And you know, sometimes it works straight away, but sometimes the body needs time to readjust. And it is really important to give yourself plenty of time and not wait until you're ready to start falling pregnant, when the pressure is on and things get really then difficult and complicated. So it's, and as I said, it's not just about falling pregnant, but about giving the baby a healthy mother for many, many years. And a father, by the way. It's important that, you know, the fathers who can, you know, hear me, is to also adopt a healthy lifestyle and be healthy for your own self as well, and avoid the blood pressure and diabetes and all of these, and cancer. The risk of cancer with excessive weight is also high. So it's a big epidemic that we have in Australia, and it's very, very important that people are, you know, mindful of managing it.
Thank you very much for your time. Have you got anything else that you would like to add that maybe we haven't covered?
It's my pleasure, Kathy. I think you're doing a great job with what you do, and we're always here and happy to help anything we can, and it's always lovely to chat.
I really appreciate you stepping in at short notice to cover.
Anytime, and make sure you come to our Christmas party.
Yes, I will do that too.
Wonderful. Wonderful. All the best.
You've made me commit to it now.
Excellent.
All right, take care. I'll talk to you soon. Bye-bye.
Bye-bye.